Everyone is going to die. Today, more than ever, we are able to make choices about when we choose to die. My husband Don was a homesteader who farmed and raised 4 children. He was a strong, active, and caring man. He lived life on his own terms. We were married for 32 years. He lived well with prostate cancer for 26 years, but eventually the cancer moved into his bones and he became palliative. His fears for this stage had always been pain control and dying on his terms. And for this reason, we were strong supporters of medical assistance in dying, or MAID. When we consulted with the palliative care physician, we knew we would receive excellent pain management support, but we were told they did not provide MAID services and offered no alternative information or options to access it. Through my role as a patient and family advisor, I knew that AHS had policies and procedures in place for people who wanted to access MAID, so I persevered. The process was complex and time-consuming and required a lot of paperwork. Thankfully, there are excellent MAID navigators. She explained what was needed and helped me prod those who were slow getting forms done. I was so grateful when she told me there was a local physician who provided the service. As Don's health declined, caring for him as well as explaining MAID to others, including our family doctor, was exhausting. Thankfully, I had the support of our 4 kids who rotated through being with us and being a support to their dad. For months, as we worked through the process, Don asked me with questioning eyes, "Was it done yet?" And it was remarkable to me how a calmness settled on Don when I could finally tell him that everything was in place. I could tell that he was now in control of something again. It would be his decision. Finally, the physician who would be providing MAID for Don came to the house to talk with him and do some paperwork. We didn't know what to expect after all the months of struggling to get to this point, and I was nervous as he sat and talked to us, Don, me, and our 2 daughters. The doctor was a very kind and gentle man. Don was hard of hearing, so he sat on the hospital bed in our living room so he could hear him. He answered all our questions and emphasized that the decision was Don's, and if he decided the day had come, he would be there for us. The day Don died was calm. With us were his brother, 1 daughter, and 1 son. The others were there in spirit. There was lots of conversation. We were all ready, Don most of all. Our home care coordinator assisted the physician, and I am so grateful she chose to be there with us. I was told hearing is the last sense we lose, so I held Don's hand, put my head on his chest, and talked to him, as first he fell asleep and then had the medication administered. Don slipped away quietly. We all felt so privileged to help him die, the same way that he had lived, on his own terms.